name is Chong, and I'm a fertility dietitian who based in Brisbane, Australia, and I'm also the host of the YouTube Fertility Nutrition TV. Now, welcome to our very special monthly Q&A Instagram episode. Now, whether you are planning to start a family, currently trying to conceive, or if you have been struggling to get pregnant or thinking about pursuing IVF, I'm here to help you, to give you simple, actionable, step-by-step nutrition strategies to help you to bring you one step closer to your pregnancy dream. I also have a very special program. It's called the Master Your Fertility program to really walk you through the full-step process based on the current proven scientific strategies to help you to optimize your egg quality. And also, the most important thing is to customize to your individual needs to really help to regain control of your fertility and fast track your pregnancy dream. So if you're interested to joining that, I will also attach the Master Your Fertility program information down the description box below, or you can also find out more information while I'll link in our bio. So as promised here, today we are going to answer questions from all of you here, from our fabulous viewer. And before our live, I already asked people to submit their questions, and we have got quite a few our audience or subscriber already submitted the questions, which is great. So let's dive into that. So my first question is actually from Anita. So Anita asked, Catherine, can you help with low AMH level, and what would you suggest the best nutrition tips to prepare for IVF treatment? So Anita, thank you so much for asking this question. Such a fabulous question. So now, first thing first, what is AMH? So AMH is also known as the anti-Mullerian hormones or the ovarian reserve. So what it means is unlike men, right, who continually to produce sperm, but for women, we actually really depends on the age. So age is still one of the biggest factors that will affect our fertility. So basically, the number of eggs will decline as we all age naturally, especially after the age of 30, and even decline further at a faster pace after the age of 35. So AMH is a simple blood test that your doctors or fertility specialists may measure to determine what is the ovarian reserve. So I suppose, Anita, if you are already tested to have a low AMH level, my suggestion is really, it is really the time that you want to focus on what can you do in terms of your nutrition that are within your control. Although, your egg count might be a little bit low at the moment, but I want to remind you that it's so important that we only need one egg to conceive. So you certainly want to spend more time and energy focus on what other things or steps can help you to maximize the egg quality. So some of the steps I would suggest which can help you to optimize your egg quality, and also if you are thinking about pursuing IVF, you definitely want to have a look around in terms of your diet. What is the current quality, like in terms of quality of food you are eating? So a research shows that there is a 65% increase chances of pregnancy associated with women who follow a good nutritious preconception diet 6 months before IVF treatments. There is a 65 increase chance of having a successful pregnancy. So certainly we're looking at a fertility friendly diet like the Mediterranean eating style, really focus on abundance of fruits and vegetables, having more oily fish such as like salmon, tuna or sardines, less red meat consumption, and most importantly your whole grain as well. So these are some of the eating patterns that has been very very, very well researched that can help to maximize the result of IVF treatment as well as boost your fertility needs. Now, secondly, I probably will also suggest you is to think about whether or not you need to optimize your weight, whether you are having, say for example, if you're having current body fat level is too high or too low as well. So both scenarios here can all impact your fertility as well. Certainly, if you decide to work with me one-on-one, I will be also looking at that as well. And thirdly is you may need a customized nutrition supplement routine to help you to further boost your egg health. So certainly these three areas I will be looking into working with you to help you to improve your egg quality and also best prepare for IVF. So Anita, hopefully I answer your questions well. Now, second question who sent in is from Sharon. So Sharon asks, should I be taking a CoQ10 supplement? So coenzyme Q10 is what Sharon's asking. Fabulous question. Thank you so much, Sharon, for sending in your question. So first of all, CoQ10 supplement, also known as the coenzyme Q10, or in another clinical term, is called ubiquinone. So it is a fat soluble and it is an antioxidant supplement that helps your body to re-energize the egg cell and also to act as a body defense to your DNA breakdown. So like a very strong dose of antioxidant. Now, it is naturally produced in our body. A lot of people actually don't know that. You can find CoQ10 naturally in some of our foods such as red meat, fish, nuts, and even avocado. However, again, the amount of CoQ10 in food may not be as high as coping your body need, as again, one of the reasons why is as we all age, our body just not able to keep up the demand to produce enough of cellular energy. So I guess, Sharon, to answer your questions, it's worthwhile to definitely look into CoQ10 supplement if you are above the age of 30. That's what I would suggest. And generally, when I work with patients or client one-on-one, if they're above the age of 30, and have been trying to conceive for quite a while, I would certainly recommend to probably add on CoQ10 supplement. But again, depends on the quality of your diet. Now, the most important thing again, it will be best to work with a fertility dietitian before choosing your CoQ10 supplement. Why? A few reasons. So there are two different types of CoQ10 in the market. So I generally recommend the better absorption form. It's called ubiquinone, and it comes into different dosage as well. So it will be best to further assess your individual needs before we recommend which brand suits you. And another thing as well, CoQ10 for some people, they might also suffer some mild side effects. And most importantly, we don't advise you to take it through, especially during your pregnancy or before your IVF treatment. We may suggest to stop as well. It's because it's just there are currently lack of a lot of research study or safety data for the use of CoQ10 during pregnancy. So I would say that, look, Sharon, it's worthwhile that we are considering the CoQ10, but I would be more really confident if I can see you one-on-one. That would be great. That would be really helpful for me to help you to customize the right brand and right dose for you. All right, Sharon, I hope that answered your question. Now, the third questions we have, which is also our final questions, which is from Natasha, who sent in earlier today. Natasha asks, is there anything can help with embryo implantations, as I have 2 unsuccessful rounds of IVF? Great question, Natasha. And it's certainly you are not the only one who has been going through the same thing. Even in my practice, I have worked with so many clients who are still in this fertility journey, trying to navigate around their IVF journey. So I'm really glad that you're sending this question. So yes, the answer is research has shown that again, that Mediterranean eating patterns can help to increase the chances of a successful pregnancy. And secondly, in specifically whole grain foods such as like brown rice, quinoa, buckwheat, raw oats, has also shown that it can increase the endometrial thickness, as well as helping with higher probability of successful implantation. So I would definitely be looking at these two points here. So one, are you already having a Mediterranean friendly eating style? And secondly, are you having the right type of carbohydrate, in specifically the healthy grain, the unprocessed grain? So that will be the two areas that I will be looking at. And thirdly is we often talk about the omega-3 supplements, not even supplement, like say naturally from food, and also you may need additional supplements to really help to reduce your body inflammations and some of the other things that can also help with the oxidation stress. And this is exactly why I guess that the one-on-one consultation is really important to understand your specific needs, your health profile, to help you to customize a plan for you. And again, the sooner you start, the better. So generally, it takes about 3 months to optimize your egg health. So it's never too late for sure. And the sooner you can start to implement some of the nutrition tips, that will be certainly helpful for you. Alright then, I hope you find this monthly Q&A episode helpful. As usual, if you have any more questions, please feel free to send me a DM. I'll be, very happy to help you out from there. Before I go, if you enjoyed this episode, don't forget to press the subscribe button and to feel free to share with your friends as well. And don't forget, I do have a 5-day free fertility meal plan for you available for you to download. You can visit our link in our profile, or I will attach the download button, the description link below our video as well. So thank you so much everyone for joining me, and I will see you again the same time next week at the same place. Bye for now.